Good evening, welcome to Left, Right and Centre. I'm Vishnu Shom. On the programme tonight, it's a big day for India in the fight against COVID. All citizens above the age of 45 will get the vaccine, and this couldn't have come a day too late. There is clear evidence that the far more transmissible UK mutant strain is now active in India. It's clearly causing havoc in Punjab. We'll bring you details. Today an SOS was sounded by the Punjab Chief Minister saying let the vaccinations continue with more people being involved, more people being vaccinated, and by the end of the day there was that key announcement by the government that starting the 1st of April all citizens of the age of 45 can register on that same CoWIN app, and that is absolutely great news. Meanwhile, take a look at this video. Festivals and elections where no one cares at all. These are all potential super spreader events, and it's taking place all across the country. There is no question of any mask discipline over here. When elections come, our political leaders seem to be caring less by the day on COVID discipline. When religious festivals emerge, nobody seems to care at all. We now know as a fact that the UK mutant strain is active in India. The numbers in Punjab tell a clear story on this. Why then are we having to see something like this? Is there any value to life in our country in the manner that needs to be there? That really is the question. So let's just give you an idea about why this is a concern now and why you can't believe for a moment that COVID is over or it was there last year. We are back at our jobs and people seem to be better and NDTV is scaring us. We aren't scaring you at all. These are government numbers. The fact of the matter is that it's 40,715 cases in the last 24 hours. That is down somewhat, but that number is still very large, and this is what you need to really look at, and it's worrying. The positivity rate is 3.9%. That is the highest since November. That positivity rate is frankly untenable if we are to improve the situation. So here's another key factor we talk about, and we perhaps need to speak about it a lot more. What's called the R factor. It's in fact the rate at which the virus propagates itself, in a sense reproduces itself, and that is calculated now to be at 1.33%. That's risen for the 14th straight day, and it's the highest since April. For India to be winning, we need this to be not 1.33 but less than 1, and we are nowhere close to that taking place. This is just going up. If it's less than 1, the R factor, it indicates that we may be winning the battle. We are losing it at this stage. The average number of daily cases has risen to almost 40,000. That is up a whopping 68% in a week. And therefore you could ask this question, look, nobody ever maintained COVID discipline across our country. How many people were worried about wearing a mask out on the roads? We still seem to be winning the battle. What has changed? And the answer is perhaps now becoming more and more clear: mutant strains. And we'll tell you how there is now clear evidence of that. We've been discussing it. The Punjab case. Now the Chief Minister Amrinder Singh and the Punjab government in a statement today have said that 81% of 401 samples which were sent for genome testings, genome sequencing, have shown this, the UK variant. The UK variant is 70% more transmissible than the normal variant, the old variant which has been here in India. Now it's not necessarily more lethal, though even that is disputed. It just means that more people are likely to get it, and that is a big cause of concern. The more people get it, the possibility of people losing their lives does go up, but the viral load, the nature of the virus itself doesn't lend it to be more deadly. So it's a bit of a contradiction there, but the fact is more people get sick and much faster. If you look at this in Punjab itself and look at the peaks. Now Punjab peaked in terms of COVID between August and September. After that there was a sharp slide going down, and then it sort of went up again, but then plateaued out somewhat in the month of middle of November to the middle of December, and then it went down sharply. And at this stage, who wouldn't say that Punjab was winning? the fight. But then now, this is where we are between, let us say, the month of February to March. We see this huge rise going upwards, and that's clearly bad news. And that is because, to a certain extent, of this 81% of 401 samples have shown the UK variant. This isn't to say that people are following all the COVID rules. They aren't, and it's a problem across the country. Certainly in Punjab, the numbers have gone up also because of that, but this is certainly an additional factor. And here's another state that all of a sudden we haven't been speaking about because it's not been in the news. At 1,640 cases, Gujarat's COVID cases have now hit a new high. This is a 7-day average that you see over here. Again, from, let us say, the 25th of December, it's been going down. Things seem to be very, very normal. Under that 500 mark, was Gujarat. And then this is where we see Gujarat at this stage. This is all seriously bad news, and I don't think that we should hide from this reality that we have today. But the good news is that finally, some would say belatedly, the government says if you are of the age of 45 and above, you don't need comorbidities, start registering from the 1st of April on the CoWIN app. You will get your vaccines. Joining us now, Dr. K.K. Talwar, advisor to the Punjab government on health and medical education. He's very much a key sort of person to interpret the data coming on Punjab. We'll talk to him closely. Dr. Shekhar Mande, Director General of CSIR. Dr. Preeti Kumar, Vice President at Public Health System Support at the Public Health Foundation of India. Dr. Samir Dani joins us as well at Apollo Hospitals in Ahmedabad, and Dr. S.K. Sareen. I'd like to thank you all very much for joining us. These are some of the finest medical minds in the country. They are doctors, they are epidemiologists, they are advisors, and they are managers in terms of how we are fighting this. Let me go across to Dr. Talwar first. Dr. Talwar, the mutant strain in Punjab, is that limited, the breakout, to certain areas, certain pockets, certain residential areas, or is there a fear that it's gotten to a larger population?
Thank you so much for this opportunity. I think the lab which sent the sample was across from all the state. So I think this is probably reflecting the sort of spread into not pockets, but I think spread over the state. I think we have some districts where their number is more, some are less, but otherwise I feel that this is spread out. It's not that it's localized to some pockets that we have this kind of a variant. Of course, we have sent more samples for analysis. Another 400 samples are, I think, to be analyzed more. We will have more data, I think, the next few days, but that is the situation.
How many more samples have you sent, sir, out of curiosity?
I think total we sent about another 400 samples are still awaited, and the reports may come in the next few days.
Dr. Talwar, in terms of the patients, those who've contracted this strain, is there anything that you can tell us clinically about what you're seeing? Is it less virulent? Does it appear to be less virulent? Does it last for a shorter period of time? Is there anything that you can share from a clinical standpoint?
Yes, the clinical picture seems to be similar. We are not, except that I think I'll say that patients probably are becoming a little more symptomatic early. And as for the severity, I think it's same. I think what we had in September or so, or August, it looks to be similar. I don't think that even the UK variants, whatever the information is, that virulence wise it's same. It's only the transmission is very high, and particularly to younger people. And that's why probably in the last few months when the schools and colleges were functioning, and that may be one reason that probably the spread becomes, and we had to take these steps of closing schools and colleges. But the virulence wise, I think seems to be similar. We have no clinical feature to say that there is some kind of a different from the original or the wild virus.
Dr. Talwar, when you say that younger people are more easily affected, are you talking about children?
No, I'm talking like in our last analysis in a month, what we saw that among the positive patients, 35 to 40% were below the age of 30. So I am sort of, this was a kind
so
of
35 to 40% of those who have contracted the UK strain are below the age of 30, below
30,
40.
yes, that's right.
Of 30.
I mean, those who are positive. I mean, UK strain is around 80%, but if you see, but those who are out of our total positive, 35 to 40% were below the age of 30. So it means that younger people, college-going students, I think they are the probably one which were getting more infected and also then spreading it.
And Doctor, you are assuming, Dr. Talwar, that the numbers are substantially higher of the UK strain itself. That the breakout in Punjab is primarily the UK strain. Is that accurate?
No, I think we have to only go by the data, which is now the samples of out of 400. We have been told that 80% are UK sort of mutants positive. So I think we'll have to sort of, we are waiting for the another 400 samples, and probably we'll be sending more samples to look at to this.
Dr. Mande, we were talking about this yesterday. Now, this has happened in Punjab. Is there a worry that given this, it's science, it's statistics now, it's a proven fact, that it's this UK strain which might be responsible for the rise in, say, Maharashtra?
So, Maharashtra, thankfully, yesterday's after discussion, we did get in touch with them, and we had a very productive yesterday evening after our discussion, meeting with the Maharashtra people, and that's going forward very well. But we will need to wait for the data to come out, because, there's a possibility that there might be UK strain. There's also a possibility there might not be UK strain. So to say definitively that some strain outbreak is there in Maharashtra is not right at this moment. We'll have to wait for the data to come out.
So just in terms of the process, Dr. Mande, how many samples is, say, Maharashtra going to send across? And how soon before you have robust statistics to give us an idea one way or the other?
So Maharashtra will probably send something similar to what model we have with Kerala, and what Dr. Talwar of course would tell you that Punjab and NCDC, they do it together. Some similar numbers that the statistical sampling, and we will actually
What numbers would that be, sir, just out of curiosity?
So Dr. Talwar is right to say that a few hundred per week.
No, sir, I think total sample up till now, as I mentioned, is about 874 that we have sent it to 3 different labs. The NCDC, as well as IGIV, as well as National Institute of Virology.
Okay.
And we got our result from 60 sample was earlier result from IGIV, and now 400 plus samples from NCDC, which have mentioned to be positivity of 80% plus. Our earlier sample 60, which came from IGIV, that's about 3 weeks back. There was only one UK migrant. And there were 2 of N440K, and so that was the figure about 3-4 weeks. But that was samples. Probably we have been sending sample from November onwards, as
right.
You know.
Okay, so there would be a robust number from Maharashtra, and then you'd get an idea. Dr. Dani, you're a senior cardiologist at Apollo Hospitals in Ahmedabad. Again, from a clinical standpoint, are you seeing what are you seeing? Because the rise in numbers in Gujarat is now a matter of concern. Are you seeing this on the ground as well among patients?
Yes, absolutely. It is a matter of great concern. In fact, we had the numbers of COVID going down in January, and so much so that many of the hospitals which were COVID designated kind of delisted themselves from COVID services. And now the COVID patients are, the COVID numbers are again on rise, and the hospital beds are filling up fast. So it's a matter of great concern. Of course, we have in Gujarat the curfew, night curfew in action or implemented since December, and now it has been, the hours have been extended further. That is, I'm sure that is helping, but we all need to spread more and more public awareness about the protective measures which we all should take.
So, Dr. Dani, I'm just trying to understand, it's an open border between Maharashtra, Gujarat, and therefore if there are mutant strains, we don't know which one, we know that there are some over there. Is that also a worry for you that, you may be dealing with something which is far more transmissible, but you don't know that for sure as yet? I mean, have there been samples sent for more genome sequencing from Gujarat?
Yes, we already have, I think, 26 confirmed cases with the foreign strains, and that is from UK, Brazil and South Africa. And I think Gujarat government has decided to send 5% of all positive samples for further sequencing.
Okay, so that's a welcome sign. Dr. Soaring, I think one point in all of this that we don't talk about is we always seem to draw some sort of strength from the fact that we are a young population and that people usually recover. Our recovery rate is fantastic and that's great. But people don't talk about how the impact of COVID people are only now learning about. It affects various organs in the body. So to say that, our mortality rate is quite low, that's great, but shouldn't we also remember and remind people that this affects your body in massive ways?
Yeah, that's certainly true what you are saying. One or two points to what Dr. Talwar and Dr. Monday says, that it's the natural course, and you showed it in the beginning that the R is 1.3 plus. So it is not when R is 1:1, the reduction will only come when it is 0.5, 0.2. So there is a decline which we require. And as per Punjab, numbers have gone up to about 80%. This is the same way it happened in Britain, or it happened in Finland and other countries. So I think every state, every area in the country should be ready, yes, that the mutant strain might take over. So, we can immensely sequence the virus, but the bottom line remains, let us accept that the mutant virus is there, it will spread, it takes 12 weeks, so we may have dominant as a mutant strain rather than the wild type. And therefore people should be aware that it is more transmissible and the numbers are rising, so we should remember that we have to protect, and of course we have to have testing and tracking very, very seriously.
Dr. Soaring, you said 12 weeks. What do you mean it takes 12 weeks? I haven't understood.
The natural viral, the way the pandemic waves are, they are of about 12 weeks or so. If you have the first patient controlled very well, then whichever is the asymptomatic or pre-symptomatic, preclinical group is, they will also transmit, but the virus wave will go away from that area in 12 weeks time. That is the natural course. But if you are not containing, then one after the other, so the one to the second, second to the third will continue. So if we test and track and control today and not let the numbers go, then only, but the way the numbers are going, you have all these big festivals, you have big things coming, so the numbers will keep on rising. What I want to say is, if we try and stop it today, then the peak R1 will come somewhere around April end. And the decline we may see, if everything goes well, not before May end. So we have to be extremely careful for next at least 12 weeks or so. The surge is on, 3-4 weeks have gone, so maybe another 8 weeks are required till we have stabilization and showing some decline or so.
Yeah. Dr. Preeti Kumar, when we see these images of massive rallies, election rallies, or a Kumbh Mela, or of holy celebrations, in Mathura and things like that, and the fact that people by the thousands are there and are present, are we not asking for trouble? It almost seems that this discussion may as well have been on an alien planet, because what's happening on the ground is different.
Quite right. When we talk about we, it's almost like, health workers are supposed to go and test, and somebody is supposed to do contact tracing, and somebody is supposed to treat the patient at the hospital. But the word we should be much more encompassing. There is simply no way that any epidemic can be addressed without the complete cooperation of both the community and everybody, and all the health providers and the government. So it has to be a collective action. And I do agree that the communication around the non-pharmaceutical interventions, all of it which we seem to know about wearing mask, but is it consistent? Is it always that we wear a mask properly? That messaging needs to be strengthened if we have to control it. Countries like Japan, they have the 3 C's. It's understood widely, not followed. So it is about not going into crowded places. We have to control that. Reducing the contact and the closed spaces. And I think all the 3 are somehow missing at the moment. So unless we decide to have a control over the community's participation in these 3 C, I admit it will be a difficult battle and an uphill battle.
Dr. Mande, how is the new vaccination drive going to work? You register on CoWIN from the 1st of April onwards. Again, are you not worried about massive lines, massive queues at hospitals, because many more people will be interested? So how is that going to be regulated? Because the numbers are now going to be staggering.
Yes, indeed. But what we have to appreciate the fact is that the way vaccination has been rolled out in the country has been done in a very systematic way. Initially, there was a dry run that was made across the country so that the people got trained how we are going to do it. Then the app was rolled out. Then there was phase 1 in which all the healthcare workers and doctors got vaccinated, and a phase 2 in which people above the age of 60 or those with comorbidities above the age of 45. Now all this experience, although we may criticize people, government, everyone, there have been here and there few hiccups, but nonetheless it has actually progressed pretty well. I mean, compared to many other countries, this entire massive exercise has progressed quite well, and I'm sure Dr. Soaring and Dr. Talwar would agree with that, because they have been themselves involved in vaccination in their own centers. So in a sense, there is a preparation which is on ground, and let us hope that it goes perfectly well beyond April 1st.
Okay, last couple of questions. Dr. Dani, again for the benefit of our viewers, the impact of COVID, we keep talking about death tolls and mortality rate. That's all great that we have it low in India, people are recovering. But as a doctor, dealing with patients on a daily basis, what are you learning, what are you seeing in terms of a long-term impact?
See, we have experienced very much what European countries and other countries, including America, has experienced. We have experienced little lower mortality rate, which is a great thing. But and the reasons postulated are many. We need not go into details of those. Having said that, we have seen a lot of COVID morbidities as well, and we are also seeing the long COVID syndrome. We are also seeing the COVID fatigue, and there are many patients who have not recovered fully well. Moreover, we are also seeing, after recovery from COVID, we are seeing many patients experiencing cardiac complications, especially the thrombotic complications. They come with acute myocardial infarction, they come with vascular thrombosis, they come with thrombotic strokes, they come with lower limb artery thrombosis, even renal artery and splanchnic artery thrombosis. We have had number of cases like this, and that is really worrisome. So actual impact of COVID on healthcare scenario will take us months, maybe a couple of years to figure out what it has done to our
bodies,
overall health.
Yeah. Dr. Soaring, last word to you. I have only a minute. There was this terrible situation a few months back in the United Kingdom where doctors in hospitals had to make a choice about who they could save and therefore give a bed to, and who they couldn't save. In a country like ours, given what we've seen in Brazil, different virus, different mutation, but in the United Kingdom as well, what we've seen in parts of Europe, should we be prepared for the worst in this country as well?
Well, we should certainly be prepared the way things are going up. I think we should be extra cautious. And two things I would like to add in the limited time is, one is the vaccine hesitancy because of the Covishield and others, that there has been a clot. I think we will lose more lives by this hesitancy than by simple, 30 people out of 5 million in UK, that is 0.0006. Nothing compared to the lives we will lose if the mutant virus comes. So therefore, please do not hesitate, get your shot. The second point is that at least first dose should be given to as many people as possible so that the vaccine, there is new data. The third point from Delhi Sero survey was that 56% of the people had some antibodies. So now it is known that only 1/4 to half of them have protective antibodies. But if you take one shot and you were exposed in the past, your antibodies will go up skyrocketing. So therefore everyone should get a shot in my mind, and of course we should have all the cautions, be prepared, and we have learned in the last few months how to handle severe COVID, go to the hospitals fast, and that might be the best way, and we have to win this war. We can't just let it go.
No, we can't. vaccine hesitancy is such a luxury in our country or in the world. Why should we be discussing it at all? Do people not want to save their lives? I'd like to thank you all very much for joining us. We'll continue to bring our viewers information on what is perhaps the biggest battle in our lives, a battle against this disease. We'll take a short break, more coming up.